One other thing to talk about in terms of pain management is there's other modalities that we can use to try to reduce the amount of pain that people feel that aren't opiates. So there's things like curcumin, which is a supplement that you can get over the counter. It's derived from the spice turmeric, which actually is quite helpful for joint pain. And we're finding more and more that it's actually a useful ingredient, or kind of a supplement for daily use. Other things are like the TCAs. TCAs like amitriptyline, nortriptyline. These can be helpful chronically for reducing the amount of pain that people are in, although they can cause side effects as well. Other options that you can use are things like Lyrica and gabapentin. Lyrica and gabapentin, which help with neuropathic pain. So typically things like sciatica or diabetic neuropathy, these are helpful. Or things like fibromyalgia. One thing to be careful about with these is they can cause drowsiness and confusion. But they can be helpful as adjuncts and ultimately decreasing the amount of pain that people are in, so they require less narcotics. There's also things like lidocaine, like patches, that can be helpful to reduce kind of surface level pain. Oftentimes helpful for like things like shingles, or even just arthritis. Actually, if they're having kind of more surface level pain, it's a little bit annoying to use, but in the right patient, it can be helpful. TENS units, which are these patches that you can apply to a skin surface, and they're connected to a little electronic unit, and they send millions of tiny shocks to the skin surface, which acts like acupuncture to distract your body from the pain that they feel. These can be expensive, but actually you can get them on Amazon for like $25. And so they're an option that some of my patients use as well. So I think that's kind of a basic overview of pain. There's lots more to it, and pain management doctors oftentimes do injections and stuff like that to help with it. But I think this is kind of a good baseline for what you will probably need in your clinical practice in the future. Thanks.